Aloha. Good morning, everyone. I see we have a few more attendees just logging on. It is 10 o'clock right on the dot, and we love to be punctual here at Hawaii Care Choices. But aloha, everyone. Welcome to Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning. Thank you so much for joining us on this beautiful Tuesday morning. Before we get started, I want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. For those joining us on Zoom webinar, the bottom of your screen should look like this. Please click on the chat box and say aloha to everyone here and let us know where you're joining in from. We will be asking you questions throughout the presentation, so please raise your hand using that middle button and send us feedback. Lastly, please click on the Q&A box at the bottom at any time to submit your questions to our panelists. To those of you joining on Facebook Live, aloha. Please use the comment box to say aloha and let us know where you are joining in from. Feel free to chat in questions as well and share your reactions with us during this talk story using your reaction buttons. We love to see the hearts, thumbs up, and even that care button. I will be asking you questions throughout the presentation as well, so stay tuned. We are also doing polling today. So for those of you who are watching on Facebook Live, you will not be able to see the polls pop up, but we still want to hear from you. So feel free to put your answers right in that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at lfukushima@hawaiicarechoices.org and I'll send you the link. Now the polling is very simple. There's no right or wrong answers. A question like this will pop up on your screen. Please make the selection you think is best and submit your poll at the bottom. Just to kick things off and make everyone comfortable, we're going to go ahead with an icebreaker. So right on your screen, we have the question, if you could have a superpower, what would it be? 1, to read minds, 2, to become invisible, or 3, to be able to fly. Again, those on Facebook, go ahead, put that in the comments. If you had a superpower, would you rather read minds, become invisible, or be able to fly? Go ahead and click that submit button once you've made your choice. Again, no right or wrong answers here. I think you can even change your mind at this point. But we just want to get you all very comfortable this morning. So I'm going to go ahead and end the polling right there and share the results. So for those of you on Zoom, 33% would want to read minds, 6% would like to become invisible, and 61% would be able to fly. Well, great. That is all to it on the pollings. You guys are all so smart and had your coffee today. I love it. We even got some people on Facebook. Aloha, thank you so much for joining in. I would like to now introduce to you our guest speakers today. We have Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, and is our wonderful presenter on all of our healthcare talk stories. So if any of you on Facebook or Zoom have heard Lonnie before, send her those comments or chat in to say hello and give her some hearts. I know she would love it. Aloha, Lonnie. We also have Kerri Okamura, Director of Pharmacy from KTA Superstores. Aloha, Kerri. And last but definitely not least, we have Dr. Lynda Dolan, Palliative Care Hospice Care Specialist and Family Medicine Physician here. Aloha, Dr. Dolan. Thank you so much for our panelists for taking your time out to be with us this morning. And thank you for all of those who had joined us both on Facebook and on Zoom. Without further ado, I'm going to dive right into some questions that we've previously collected in advance from our audience. And this first question is going to go to Dr. Dolan. Hello, good morning.
Good morning.
So Dr. Dolan, recently there has been more than 700 active COVID cases on the Big Island. What do we know about the Delta variant to stay safe? Or what do we need to know about the Delta variant to stay safe?
So the Delta variant is a variant of COVID. It is extremely prevalent in our community, and it's basically the, I would call it the going COVID flavor right now. It is highly contagious. That's what we know about it. And it does cause significant symptoms and disease in those who are unvaccinated. Vaccinated people are catching the COVID virus as well. The majority of them, again, are Delta as well, because it is very contagious, but their symptoms are much less, sometimes very negligible. Sniffly nose, a little bit of a cough, and that's sort of the standard that's happening. And people say, well, why do I know if I have Delta or not? We don't test for, we test for COVID, and Kerri can get a little bit more into that, but then those tests go to a lab and they compile all of the various tests and see what type of COVID they are. And that's how they know. We become a number, right? If I was tested, I become test number 20 in the state lab, and then they look at all those tests, how many of them were Delta. And that's how we know that that's the majority that's in our community right now. Because some people ask, I want to know if I have the Delta variant. Well, if you're Vegas better, the possibility is really high that you do have it as the type of COVID.
Okay, thank you so much, Dr. Dolan. And I know we do have a questionnaire, for testing, but the next question I will ask Kerri is, how easy is it to get vaccinated at KTA, and which vaccines are offered? Oh, so sorry, Kerri, you're on.
I know. I'm pressing the wrong buttons. Come on.
Totally fine. That is the glowing quote for 2021.
Yeah, you're on mute. So we offer COVID vaccinations at all of our pharmacies. We've definitely seen an uptick in the number of people coming in to get vaccinated. And we are also doing COVID vaccines at our testing sites in Hilo, Kona, and Waimea. So on the same days, at the same times that there's community testing that we're doing. All of our pharmacies have, well, we're getting more J&J this week because we ran out. And so we are out of stock of that at some of our pharmacies, but all of our pharmacies will have, normally J&J and either the Moderna or Pfizer or all three. It's walk-in, so no appointment is necessary. There might be a little bit of a wait now just because the volume of people are coming in to get vaccinated is a little higher than we saw maybe just about a month ago. So, and there's a lot of community partners, community access to vaccinations. I think most pharmacies are offering them now.
Okay, that is awesome. I know you did mention that you have community places where you are testing. Are people able to get COVID tested at the pharmacy? And this goes for Kerri as well.
So right now, they cannot get tested at our pharmacy. We're basically focusing a lot of our efforts and manpower on doing community testing. So, that was our initial plan because we thought, the numbers are going down and it would just be a here and there kind of situation, but we are asked to help with community testing. So we are not offering COVID testing at our pharmacies right now.
Awesome. And one more question for Kerri. How would you respond to those who are hesitant to take the vaccination in fear of a negative side effect? I know you mentioned that Johnson & Johnson, you guys are out and there was a previous, side effect of blood clotting. What would you say to those who are hesitant to get the vaccination?
So the vaccine is safe and effective. It's very effective in preventing serious illness due to COVID. There are very few reasons why you shouldn't get the vaccine, the COVID vaccine. And I would encourage everyone to get it as soon as they can. People worry about it being approved too quickly, or if it's not quite FDA, they don't have full FDA approval yet. But really, when you think about the sheer number of people and the sheer number of doses that have been given of the vaccine, there's no reason to doubt its safety and effectiveness.
Okay, wonderful. Thank you so much, Kerri. Dr. Dolan, I have a question for you. Can vaccinated people spread COVID just as easily as those who are unvaccinated?
That's a great question. And I'd like to just tag on to what Kerri said about people getting vaccinated. In my 22-year career, I'm aging myself in healthcare. This is the most amazing medical feat that our country and the world has accomplished, even bigger than polio vaccine in that, in terms of developing the technology which existed before COVID, but knowing that technology, and we found COVID a way to use the mRNA technology and getting it out there, and the sheer number of vaccinations and the minimal amount of side effects that we have seen across millions and millions of people. So great question about, can vaccinated folks spread COVID? That seems to change by the moment, and I'm a very conservative person, and so I basically say the likelihood is very, very small, because you are carrying it in a smaller quantity in your nose. However, all it takes is one virus to get out and attach to someone else. So I always tell people, assume the worst, protect yourself, protect others, wear your mask, gel your hands, all of that. Because with these new variants coming out, they become more virulent, and we don't know the quantity that is going to be living in our nose, which then if you have a higher quantity, it's easier to spread it out from your nose and your sneezing and coughing and that sort of thing. So I'd like to say 100% no, but I can't. Scientifically, there are some breakthroughs. So.
Okay, great. Which leads us into our next question with the precautions we can take. With school back in session, what recommendations do you have to keep children safe? And should those 12 and older get the vaccine?
Do you want me to do that one?
Yes, please, Dr. Dolan.
So the vaccine for 12 and above is safe. Some people will say, but it hasn't been tested a lot. And I can tell you, even for my 13-year-old daughter, I was like, ooh, do I do it? I was hesitant for a little while. And then I basically said, oh my gosh, well, COVID is here and now. And I want my kids safe. I want them not to have the disease. I don't want them to have long-lasting illnesses from it. And it's the here and now, and it's for living. And if something comes up 10 years from now, hopefully technology will have something to fix that at that point. But the here and now is where we're at. Hoping soon that it will get approved for 5 and above in the next several weeks. And I think that will be part of the other arm of protecting kids for school. Right now, 12 and above, get them vaccinated. Everyone in school should be wearing masks. The distancing, there is discussions about 3 feet versus 6 feet. There is basically recommendations, 3 feet is okay. 6 feet, of course, makes it more comfortable, and just encouraging and training your kids under 12 to continue to wear their mask and gel and be careful. And they need to be in school.
Yes, I agree. Yeah. Thank you so much, Dr. Dolan. Kerri, I do have a question for you. Where can people go to find testing, the testing schedule for the community testing?
So the testing schedule for community testing is on the County Civil Defense website. So it has all of the locations with the times on it. And actually that's the same for vaccination pop-ups. They have the vaccine pop-up schedule on there as well.
Okay, awesome. Some people are returning to work after travel or illness. Do they need a COVID test as well?
It's not required for return to work after travel. I think people are thinking about implementing that kind of thing back into probably their work policies, but from the government standpoint, it is not.
Okay, awesome. And one last one, how easy is it to get a COVID test, and does it cost anything?
That's a good question. So how easy is it to get a COVID test? The demand is crazy right now. So yesterday we did COVID testing at the Civic, and we tested 582 people. We had to close the gate early because we knew people in line. There's someone monitoring how long they're waiting, and they're waiting a long time. So, we have heard anything from, some people say like 45 minutes on Saturday, they're waiting. Yesterday, people were telling me they were waiting 2.5 hours. Wow. So I think, community testing, there probably needs to be more of that because the demand is so high. What we're doing at our community testing is funded, well, hopefully funded by FEMA. And so the community testing that we're doing is there's no fee. So it kind of depends on the provider and if their where their funding is coming from.
Okay.
So there's access, but I wouldn't call it easy
Yes.
right now.
Great. Well, thank you so much for answering that question. I do have a question for Dr. Dolan. How long are the vaccines effective, and will we have to consider booster shots in the near future?
That's the million-dollar question. Right now, there is not a recommendation for boosters. They have been doing studies on immune-compromised people who are on, say, medications that their immune system is weakened, people who are organ transplants, they're on suppression medicines, and they've been doing studies probably for about 9 months or so on them about their antibody levels and giving them boosters. So I think will be more data coming out in the next several weeks about the booster need for the groups, immunocompromised greater than 65 to start with. And because those are the high risk people, because you got to remember some people now we're in August and they got vaccinated in January. And do we need to boost them to give a better immune response about the Delta and maybe this Lambda variant that's coming up right behind it. So stay tuned. I suspect there will be something, but again, we're navigating this all as we go, and it's new information almost day by day. So patience and again, management, again, physically distancing, wearing masks and gelling is the way to diminish everything.
Right. Another question is for those who want to look into more on the ingredients or components of the vaccine, is there a site that they can see that it is listed just to do a little bit more personal research?
Kerri, I don't know if you want to take it. I recommend people go to the CDC site. I still think the CDC, the FDA are definitely the true tested sites. I know there's lots of other access to information that sometimes is not vetted in science or not vetted enough with repetitive testing of the information. So again, CDC and the FDA, I think, is number one.
Kerri, do you have any other websites or?
No, I agree with Dr. Dolan. Each vaccine has their own, I guess, information packet, and it's available on the CDC website, on our COVID vaccine landing page on our KTA superstores.com website.
Okay, wonderful. Dr. Dolan, this question is for you. With regards to the COVID spread, can you explain what the 7.8% means for us?
In terms of community spread rate, is that what you're?
Yes.
Yeah. So the Big Island got the award for the highest percentage spread rate. I'm not sure it's a great one to have. So what that means is based on all the community testing that Kerri's doing, all the maybe private testing that some urgent cares are doing and physicians in their office for patients who are symptomatic, they dump that all into a calculation, and they look at what our population is and the disease rate, and they come up with this percentage. 8% has been the highest it's ever been. You know, we were all worried before when it was 3% last year. So, you know, we've kind of accommodated or gotten a little less nervous. I'm pretty nervous, but it just means that it's out there, it's community spread. It could be, no offense, Kerri could be at my office, which she's not, and we could be sitting next to each other and she could have the virus in her nose and sneeze and get it to me if we don't have a mask on. So you have to assume there's the risk with anyone you meet based on that high percentage rate of transmission. Again, masking, limiting your socialization in that.
Yes, I agree. Thank you so much, Dr. Dolan. This may be for either one of you. I'm not sure who wants to take it, but if one of you can explain how and why variants are formed.
Do you want me to take it, Kerri, and then you can add on? So I'll try and explain it at, so we have a virus, and they're smart. So we have virus 1 type, which is still COVID-19. However, it can mutate. That's what we call it. So it's still COVID-19, but it gets a little extra spike on it, or it gets a little extra color to it. And the way it can mutate itself is it finds a host. The host is we humans. Predominantly right now, we can say with confidence, it's we humans who are unvaccinated. And so the virus gets in there, and then it uses the technology of mutating in within the human and develops that new color or that new spike. Then it goes out and spreads itself and finds other hosts. And then from there, it again makes a new change. It's sort of like changing your hair color. Today, I'm going to do this. I'm going to go to a hairdresser tomorrow and change my hair color again. And that's why it's hard to keep the vaccination, the type of vaccines out there above and beyond, smarter than how the COVID is mutating. So if we could decrease the hosts, which means the unvaccinated people, then the virus doesn't have a chance to go and become extra special in a different way. So hopefully that explains it a little bit.
That was definitely
kind of a
great.
simple format. Kerri, I don't know if you have anything else to add.
No, you did a great job.
I agree, for all of us non-medically inclined people. Thank you so much, Dr. Dolan. All right, another question out there goes to Dr. Dolan. Are you treating any patients with COVID? And if they are not vaccinated, are they able to get a vaccine after they are COVID negatives?
So yes, I have patients in my practice, as other people in their practices in the community have patients with COVID. And it's across the board. Some are hospitalized, some are in the community. A lot of it is one person in the family gets it, and then the rest of them get it. So that's why we say there's just so much community spread. And the treatment really is symptom relief for the fevers and the coughs and the chills and staying home. And the biggest difficulty we see is when families are now isolated, getting access to food and things like that. It's really challenging. Some families don't have ohanas to help them, and they still can't come into the house. So it's a big disruption to family life, as well as a big disruption to work life, because businesses who then have employees who are tested positive, it's a whole domino effect. Yeah, it's challenging, and we do have people that are taking a long time to recover as well. So, and then you had a part 2 to that. Oh, can they get vaccinated? Yes. So yes, you can get vaccinated after you have had COVID. The recommendation seems to be changing a little bit. And Kerri, I don't know if you have more information on it. When it first came out with the vaccines, they said about 12 weeks. Some people are shortening that up. There's actually new data that just came out that people say, well, I had COVID. That means I'm pretty good and protected. Actually, the answer is no. Your antibodies wane, and they have found that patients who've had COVID and then who get vaccinated have a very good immune response and are actually doing well. But we like that time to recover, that 12 weeks before you get inoculated.
Okay, which again goes to my next question. If you can explain just what are the worst and mildest cases you've seen, both in your patients who have been vaccinated and then both with those who have not been vaccinated.
So most of the people, everyone's heightenedly aware of if they've been out and if they've maybe been exposed, because you know, honestly, you could go to a party and there's people say they're all vaccinated and someone could be carrying it. So the mildest case I've seen is my throat's a little scratchy, that's all, but I was at this party. And it goes up from there with a cough, sniffles, headache. Some people have diarrhea. To the people who've been able to stay at home but really, really sick, is, as a couple of patients have said, I coughed up a lung. That's how much I'm coughing, and my chest is killing me, and I can't catch my breath in that. The coughing seems to be the most significant bad symptom, which goes along with why people end up getting admitted to the hospital on oxygen and on ventilators.
Okay, well, thank you so much. I do have a question for the both of you. So maybe Dr. Dolan, you can go first since you're unmuted, and then we'll have Kerri follow up. So in regards to mandating the COVID vaccine, do you feel that this should be a recommendation for all business types? And would a vaccine passport be a good idea?
I'm going to go out here on a limb. The only way for us to conquer this COVID is for people to get vaccinated. I know people have, I believe in people having an individual right and choice. However, this is a worldwide pandemic. And at this point, individualism doesn't get us out of this mess. So if that's a basic statement for, yeah, I think, I hate to use the word mandate, but if that's the only way we humans will comply, that's what we got to do. I don't see an end to this without us getting on top of it, and getting on top of it is diminishing the spread, and the vaccine is the way to get on top of it.
Okay,
So,
thank you so much, Dr.
okay.
Dolan. Kerri, what are your thoughts on it?
I have very similar thoughts. The vaccine, that's the only way we're going to get out of this. We have been in this for so long, working to get people vaccinated, and to think that we have this positivity rate in our community of 8% now. The only solution to this is getting more people vaccinated. And that's the only way we're going to end this pandemic. So I support requiring vaccinations. It's what makes sense, and there are like I said earlier, very few reasons why someone should not get vaccinated. So it's super important for us to getting back to normal, getting back to being able to gather with our friends and our family, being comfortable working safely around others, and people need to get vaccinated.
Thank you so much, Dr. Dolan and Kerri, for sharing your thoughts on that. Dr. Dolan, do you see a rise in colds and allergies among your patients and across the community still with the pandemic going on?
So interesting comment. When the pandemic first started, we had minimal flu. I can't tell you that I haven't prescribed antibiotics in a long time for bronchitis and that. During the summer, when the mask mandate changed a little bit, we definitely saw an uptick in sinus infections, a little bit bronchitis and allergies. So I think there's more science to masking than we even completely understand yet. But it definitely is a barrier that diminishes transmission of lots of things besides COVID. The flu season last year was non-existent. However, I still recommend flu vaccine this coming season. Just put a plug in there for that, because that's the other part of it. We don't want COVID and flu happening, because that could be even more detrimental overall.
Right.
So.
Thank you so much for sharing that. It's very interesting as well. Kerri, did you want to add anything to that? Do you see, a lot of less people with flu and things coming in and getting certain over-the-counter drugs for that?
Yeah, I think we definitely saw a decrease in the flu last season. And like Dr. Dolan mentioned, it's still important to get the flu shot. They were saying if you get the flu and COVID at the same time, it's like, that's even worse, and detrimental on your health. So it's flu shot season's coming up. Everyone should get their flu shot again.
All right, thank you. Also, a question for Kerri. Is there something about KTA Pharmacy that most people don't know that's beneficial for the community, or to the community, sorry?
So I think for KTA, we have a pharmacy. You think we want to dispense drugs, and that's part of our business. But actually, we want to prevent illness. So we would prefer that instead of having our patients taking more medications, that we help them manage their disease better, so that, like whether it's lifestyle change or, having them monitor their blood pressure a little bit more frequently, we would like to have patients do that kind of thing rather than be on more and more medications. So it's kind of why, we do things like the diabetes self-management education, diabetes prevention program. That's just a couple of the things we do to help patients manage their diseases.
Wonderful. I did not know that. So I hope everybody just learned something new at the same time. And thank you so much, Dr. Dolan and Kerri. I don't want to take up any more of your time. You guys have been with us for a whole 30 minutes, and we're so thankful. Thank you for Dr. Dolan answering the chat question as well. So for right now, that's all the time we have for these wonderful panelists. Thank you again for all of your questions that was submitted previously and even in the chat. Thank you so much, Dr. Dolan. Is there any last words that you want to say before you leave, or Kerri as well?
Thank you for having us, and thanks for the attendees, and go out there and spread the word of getting vaccinated, please.
Thank you so much. Kerri, any last words?
Yeah, thanks for having me. And everyone stay safe out there, you know, wash your hands, use your mask, social distance, all that stuff. Keep on doing it so we can get out of this and get vaccinated.
Wonderful. Thank you so much. Again, don't want to take up more of your time. We appreciate you joining us. Aloha.
Thank you,
right.
ladies.
Well, oh my goodness, that was so fabulous. Hopefully we got most of the questions answered that were in the chat and that were submitted. So thanks to all of you who participated. And we are going to move on to Lonnie Weigert, our Community Relations Manager at Hawaii Care Choices.
Hi. Hello, everyone. Oh my gosh, Tish, that was such rapid fire questioning.
It really was. And they did such a good job at just answering, you know, so honestly. And I mean, for those of us who don't have a medical degree, it was so easy to hear as well, you know, and to understand it. I mean, I know I can change my hair color every so often. With the variant explanation was amazing from Dr. Dolan. So I hope you all enjoyed it too.
What's really important in having access to them like we did today, and allowing us to ask any question that we wanted, it was really a blessing for us to have them, because I know there's still a lot of uncertainty out there, and lack of trust and misinformation that, you know, let's just ask our doctor and pharmacist. I mean, how much better can that be for us to get the actual truth of the matter? So I'm really, really appreciative that they were able to answer all the questions, and that there were so many questions.
Yes, there was so many questions. And when do you ever get the opportunity to have your doctor and a pharmacist in the same room? You know?
Yes. In the same room.
Room together. Yeah.
That was awesome. Thank you again, Tish. You did an amazing job on that. And now, for many of you, you already are familiar with our programs, but I tell you, I love telling you about it again and again. And today is no different. So thank you. Thank you so much for you folks to come on in. And oh, hi, Rodney. How are you? It's so great, you know, because we cannot see everybody all the time. And then when we see you on the Zoom, we try not to get overexcited, but it is, you know, we haven't been able to hug each other and see each other face to face. And, you know, if we're all super diligent, that time will come again. And we're really looking forward to it. So today, I just wanted to give you a really quick overview of the 3 programs that we provide, but primarily palliative and hospice, because a lot of people still don't understand what these programs are. So just hang in there with me for a moment longer, and I'll take you on this wonderful journey. So what is palliative care? So, you know, first of all, even the word palliative, people just do not understand what that is. And so as a result, nobody wants to try to get this kind of help. Palliative is really about focusing on the relief of discomfort that happens when you have a serious or life-limiting illness. And the kinds of symptoms that people would have, like say if somebody is dealing with cancer and they're having chemotherapy or radiation, oftentimes there's some really uncomfortable symptoms that occur with that. There could be pain, there may be nausea, they can't sleep, all of those things. There's actually very specialized care for that, and it's palliative care that comes in and really provides that kind of relief. Next. So Tish, I know that we have a lot of people on Facebook as well. I don't know if there's anything that they're commenting on now, or anything that you want to reach out and say to them after.
Yes, thank you so much, Lottie. I do want to add, this is the time where we're going to ask everybody to go ahead and join in. Zoom participants, use that raise your hand, and Facebook friends, do send those care and hearts and thumbs up if you learned that palliative care can boost quality of life for patients and families. Thanks so much. We don't have any questions just yet, but just a reminder, all the Facebook users can enter those questions right there in the comment box. Thanks,
I just love that. Thank you so much, Tish. I just love that. Yes, palliative care helps boost the quality of life, not only for the patient, but for the family as well. And anyone dealing with serious illness, such as that's showing on our screen right now: cancer, congestive heart failure, COPD, advanced kidney disease. These are very serious illnesses that palliative care can certainly help with the discomfort of the side effects and symptoms. And a lot of times people don't realize that we can help patients of any age. And our service area is from Lapoihoy all the way to South Point. So for those of you who live within that area, please reach out to us if you have family or friends that could really benefit from getting some care and guidance with regard to getting that relief from having, these different treatments that are normally associated with these serious illnesses. The other thing too, when you hear palliative care, know that this is not for those who are terminally ill. Like, you don't have to have a terminal illness or diagnosis in order to participate for palliative care. Palliative care, people are going to Vegas and doing so many other things. They're still paddling and going with their grandkids down to the beach and all of that. So palliative care is really about boosting the quality of life.
I agree. So if anyone knows anyone who is suffering from any one of these symptoms, please raise your hand in Zoom or Facebook friends, hit that care button.
I saw that there was a question if dementia qualifies for palliative care. At this time, no. The 4 illnesses that we are focusing on are the 4 that are listed right here. Thank you. Yay, brain teaser.
All right, there is our brain teaser, and it is up on your screen now. The goal of palliative care is to improve the quality of life for the patients and their families. True or false? For those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to join in the Fully Engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. Thank you so much for all of those who just participated. And I'm going to go ahead and share the results. So 100% of you said true. The goal of palliative care is to improve the quality of life for patients and their families. Back to you, Lani.
Thank you so much, Tish. Yay, I love it that you folks are just listening and just following with me. Indeed, it's all about boosting that quality of life. So this is a thing, is a lot of people will say, well, my loved one has had COPD for 10 years. I mean, why should I even call for palliative care right now since he seems to be living with it? Well, there are different signs that you can see. If you notice that your loved one is going to the emergency room often, and when I say often, I'm talking about a few times in a month. That's definitely often. Or tends to be calling the doctor a lot for a lot of ailments or discomforts. And when I say talking to the doctor, calling the doctor, not only during the week, but when the doctor's ready to eat dinner or go to sleep at night and you feel that you need to make a call, that's definitely another sign that you might need it. Difficulty in managing medications. All of a sudden, there's a lot of medications. And for the most part, you start getting confused with, should I take this one? Should I take that one? And that's because nobody is managing your overall care, which is why you're getting medication from so many different places. And I'll explain that a bit more as we go on. The diminished activities of daily living, just managing your finances, driving, going to the grocery store, finding yourself at KTA and not even knowing why you're there. Actually, I take that back. That happens to me too. But also, preparing light meals and housework, throwing a load of laundry, and it's really difficult for you to do. Then maybe it's time to seek some additional help at home. And palliative care might be the exact thing for you. So, you'll also feel these other things, the pain, fatigue, swelling in the feet and legs, and nausea as well.
Facebook friends, send us a heart, and Zoom friends, raise your hand if this helped you know when palliative care is needed.
Thank you, Tish. So when should palliative care begin? Oh, Dr. Dolan says at time of diagnosis. So why this is weird for some is, somebody might be diagnosed with breast cancer and there is absolutely no discomfort, there's no symptoms, etc., so they don't call. Well, what we like to explain to everybody is it's kind of like you're gonna go to the pool and just sit down, at the edge and just hang your feet in. You're kind of like getting a feel for what care would look like and really trying to get more information, because initially when anybody gets a diagnosis, it's really quite heartbreaking. And a lot of people go immediately into panic and anxiety. So, call us right when something happens so we can be there to support, not only through the physical changes, but large emotional changes as well. And, again, we're there to help boost the quality of life.
Zoom friends, raise your hand, and Facebook friends, give me a thumbs up if you believe those with serious medical issues could live longer by signing up early.
Thank you, Tish. Why that's very important is those who sign up early, if there's less dis-ease, then people tend to be less stressed. And without all that stress, people tend to just have a better quality of life. So again, the earlier you call, the better. How palliative care works is we come to a person's home. The nurse comes, goes and takes all the vital signs, etc., evaluates the health and medical history. But really, the reason we're coming there is we want to know what is important to the patient. Tell us what your visions are for the future. Tell us what your biggest concerns are. And also we want to educate the patient and family. For example, if somebody's dealing with congestive heart failure, we would actually say, maybe it's not a great idea to have Spam and rice every single morning. Maybe we have to adjust that breakfast. So that's what we mean about that. When I'm talking about the biggest concerns, some people, they want to join their family on a Disney World vacation. So they want to know, can they do it? Can you help me be healthy enough so I can go? Or they want to go to their class reunion in Vegas, or maybe even a cruise with a bunch of great friends. But then there are others that maybe their visions are not that big, but their hopes is, I just want to get off the sofa and walk to the mailbox without just being totally out of breath. Yes, we can help with those too. So that's what I'm saying. It's really patient-centered. It's all about the patient when it comes to palliative care.
Facebook friends, send me a heart, and Zoom friends, raise your hand if you'd like this type of service for your loved one. I know I would.
Yeah. So the medication review. This one is really a big one. I found that when I would go to the homes with our palliative care nurses. So what would happen? So for example, say somebody had congestive heart failure and they have some type of event that happens at home and they're out of breath, so they go to the emergency room. Well, they get medication there. And then, they go to their cardiologist on their regular routine visit and they get medication there. And then they go to see their primary care physician and they get their medication there. And I'm sure there's other ologists that I'm not saying, but they get medication from there too. This is no joke how this couple is balancing all of the medications. We've gone to homes where there are more than 50 jars of medication on a coffee table. And what happens is that the patient starts to become overwhelmed. Like, which one do I take? Oh, this is the other thing is when I looked at the medication, some, belong to the deceased ex-husband. Some belong to adult children that no longer live in the home. And there's a bunch that's expired. But the reason people don't throw away their medications is because it's expensive. So they keep it. But sadly, what happens is they start to become novice diagnosis doctors, meaning they'll start saying, oh, well, I have a backache or I have sniffles or my arm hurts. And then they start looking in the medication and deciding on their own, oh, this one, I remember Doris took this one, so I'm going to take it. There's so much danger in that. We find that when people sign up for palliative care, when our team comes there, they review all the medication and then they work directly with the primary care physician who says, all right, these 9 medications, just put them away. You don't need all of these others that do not even belong to this patient. And then, maybe a patient was taking 28 different medications in the day, but then after we review this, they're taking maybe 12. Not to say 12 is not a lot, but gosh, it's so much better. And we find that immediately, at least 5% of their discomfort melts away. And it's largely because they were taking medication that was counteracting each other.
All right, everyone on Facebook and on Zoom, please type yes in the chat if you can relate to this story.
Thank you, Tish. So how does palliative care work again? Well, it's pain and symptom management. So we come on in and we see the patient and we find out, what's really ailing them and all of that. And then we figure out what are they taking for pain. And we start to really work with them so we can manage that. Or other things, they might not be able to sleep at night, or maybe they're constipated, or maybe they have a lot of nausea. Whatever it is, we'll get in there. We also will help them coordinate all of their doctor visits. I mean, if you've cared for anyone, about that. I mean, like, if you're not watching that calendar, you're going to miss all of the different appointments. And so we come in and we help. And sometimes our nurse will even go with the patient to the doctor. And the reason we do that is because culturally, a lot of times, we're just raised by our parents to go in and be good patients. And good patients don't ask a lot of questions. Like, get in there, listen to what the doctor says. We're going to be in there only for 7.5 minutes. And if you're asking questions, we're going to have to pinch you on the side because we don't want to bother the doctor. So I'm just saying that when our nurse goes with the patient, they are able to vocalize and really help the doctor understand that, Mrs. So-and-so is having challenges in the night. She's falling down on her way to the bathroom at night. She doesn't eat very much. She's, all of these other things that maybe the patient is not sharing with the doctor. So we really, really work as a team with the patient and family as well. And we'll get in there and help the family and the patient understand about insurance. Maybe there's other insurance benefits that they can get that they did not know about. Maybe they can qualify for Medicaid and they didn't know that. Our social worker will come in and help them as well. And very, very, very important, having an advanced care directive, which to me is one of the best gifts that you could ever give your loved one.
All right, everyone, raise your hand and send us a heart if you think this is an awesome program. And Lonnie, I do have a question for you that just popped up in the chat. Does Hawaii Care Choices have a 24-hour hotline if a patient has questions or concerns?
Yes, yes, yes. And so just calling our regular line, it goes directly into our call center. So yes, you could call at any time, 2:30 a.m. Someone's still answering that phone. So yes, do not hesitate. Give us a call.
Thank you so much, Sani. I'm going to go ahead and put that number right in the chat for those of you who need it.
Thank you so much, Tish. Thank you. So how is palliative care paid for? So there's several different ways. If any of you have Medicare, then a portion of palliative care is paid for, and any of the other insurances, HMSA, United Healthcare, and Medicaid. So this is what happens is if you have one of these insurance coverages, then you could be paying a copay of a regular doctor's visit, which could, go from $20 to $40. If you're not also covered by Medicare, or even if you just have Medicare alone, Medicaid, because Medicaid will, because we have quite a few patients that have Medicare and Medicaid. And when you have that double coverage, you normally pay nothing for any of the services. So that's why I'm saying that oftentimes when our team comes to visit a patient and their family, if we see that the patient could possibly qualify for Medicaid, we'll help them fill out those forms and get that coverage so that they can reduce their out-of-pocket expenses.
All right, everyone, raise your hand and give me a thumbs up if you now understand how palliative care is paid for. And if you have any questions about it, feel free to type that right into our chat box. Thank you.
Thank you. Okay, so now we're at the Cadillac of all services, hospice care. So what happens is that as the natural disease progression keeps going, many times people will transition into hospice care because they need a higher level of care. And that's where the team switches and there's a hospice team that comes in. So hospice is an umbrella under the palliative care umbrella. So it's also focusing on relief, but really, when I try to differentiate the two, hospice really focuses on comfort. And the philosophy of hospice is very, very different as well, because hospice treats the person versus the disease. So it's really focusing on the quality of life versus the quantity of life. So I'll give you an example. Like sometimes people are really in the end of life, but because they believe that continuing to take radiation or chemotherapy will help them extend their life, oftentimes the quality of their lives will suffer. And it's because, now they can't eat, they're so weak, they can't even get out of the bed or, sit up with the grandkids and laugh at the TV. All of that really takes a toll. So for hospice, it's not about doing any more of these heroic curative treatments. It's all about focusing on comfort, about being with your loved ones and really enjoying every breath that you take. Hospice was really created to ease terminal suffering. It wasn't created to be the Dr. Death of everything. It's like many people do come to hospice, but it is not a requirement to die. So this is what happens. People don't understand that they actually come to hospice and the really loving intention care that they receive oftentimes makes them better. And then they graduate and they go and they continue on with their lovely lives. And then they may come back to hospice care later. But initially, it is not a requirement for people to die when they come to hospice care. So it really is important to know that hospice team has specialized skills with regard to not only helping with the discomfort, but to help the family ease all of the emotional and spiritual stress that often is associated with end of life. So again, hospice focuses on comfort.
Everyone, send us a comment in the chat box and tell us if quality or quantity of life is what you want for you and your loved ones.
Thank you so much. Thank you so much, Tish. So how is hospice cared for? So, or actually paid for? So what ends up happening is that, first of all, you have to qualify for hospice. So just because somebody calls and says, I'd like hospice care, they're gonna get it. They need to be really qualifying for it. And that I'm gonna tell you what the 3 things are that require that. Hospice care is going to be provided by a care team, very similar to palliative care, but almost even a bit more comprehensive, as you can see on our care team wheel here. And also, what's really, really important is hospice doesn't just support the patient, they support the entire family. And that's something that's very, very unique with regard to the care that is provided. Because oftentimes when people go to their doctor, you know, the doctor is explaining to the family what's going on, but then the family goes home and they take care of their loved one. Our team actually comes to the home and they provide the care, the training, and the education for the family as well. And many, many people will say to me, oh my gosh, I could not have done it without the hospice team, or I wish I had called earlier because I could have used the help so much earlier.
Everyone, type yes in the comment box if at the end of life you want this type of support of an expert hospice team.
So who qualifies for hospice care? Okay, so these were the 3 things I was telling you about. The person who was suffering from terminal illness. So first of all, the person has a terminal illness. The doctors love them all. They make their best guesstimate of 6 months to live. And you know, they don't have the crystal ball. They're just thinking that, yes, this is something that they do so that Medicare will qualify the patient to receive these wonderful, wonderful services. And of course, at this point, patient is no longer seeking treatment. So they're not going to chemotherapy or radiation. They're not going for surgery or going to dialysis. You know, I remember when my father, who said to us that his only wish was he just wanted to pass at home. And we thought, piece of cake, Dad, we can do that, no problem. But he was suffering from congestive heart failure. And one evening when he couldn't breathe, ambulance came, whisked him off to the hospital. And by the time we got there, he had already passed. So that was an epic fail and huge disappointment for our family. Years later, when my mom contracted lung cancer, her doctor came to myself and my brothers and said, hey, your mom can have hospice care. And then we said, oh, can you explain to us what that is? And anyway, it sounded really incredible, particularly for us, the family, the amount of support that we could get. Knowing my mother, though, stoic Hawaiian woman, I knew she wasn't going to go for it. So I went in and I actually said it like in a really upbeat way. Mom, you can get hospice care now. You don't have to see the doctor anymore. We don't have to go down there anymore. And she goes, what? Hospice care? Oh my gosh, I don't even like that word. I can't even believe you brought it up. And I said, oh, okay, so you're not about it then. She goes, no. I said, oh, well, I heard, Mom, we can get free stuff. Oh, really? Like what? And then, of course, by then, my brothers were renting her wheelchair, and she wasn't really using that much equipment, but just the idea that we could actually get free things was it just really switched her from a medical to a financial focus. And she says, yes, well, I mean, if we can save money, then go ahead and find out about it. Well, it was wonderful because that day we were able to get her into hospice care, and to her surprise, to her very happy surprise, she saw all the wonderful things that she was able to benefit from, like the hospital bed and all these other things. And as months went by and she had gotten used to her team, because being a local woman, she doesn't like people coming over to our house if she doesn't know them. But really, we found that it only took the first visit, and then she really loved her team, and they became a huge, huge support to our family. And that's when she said to me, after months of having wonderful Cadillac of services, hospice care, oh, I wish Daddy had it too. I wish that we had known about hospice care and that his doctor would have told us, because look at all the wonderful things I have, and he could have had that too. And so now, you know, she tells me to go out and tell all the neighbors to just, you know, get that hospice care and sign them all up. And I said, wow, you know, Mom, I think that's really awesome. That's a great idea, Mom, but it's a little awkward, you know, to go to the neighbor's house. And, you know, I'm not like selling sweetbread or anything. I'm just going there. Hey, you folks want to sign up for hospice? Yeah, I don't think they're going to be about it, especially if they're not sick. Okay, so anyway, but 10 years forward, and here I am with Hawaii Care Choices, just screaming from the top of mountains about how wonderful hospice care is. And I tell you, I do that not because it's my job, but because I made my mom a promise. And here we are today.
All right, everyone, if you enjoyed Lonnie's story, I know I enjoy it every time she tells it. Send her some love. Go ahead, write a comment for her. Just give her some hearts, or even raise your hand if you enjoyed it. Thanks for sharing, Lonnie.
Here we are.
Here we are on another brain teaser. I hope everyone is still with us. Thanks for commenting in the chat box. Your polling is up on the screen right now. Hospice is where you go in your last days, true or false? So for those of you watching on Facebook Live, you will not be able to see the polls pop up, but we want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month, the 10th at 10. Just email me, lopez@hawaiicarechoices.org, and I'll send you the link. All right, so we got everybody in our polls today. I'm going to go ahead and end the polling right there and share the results. So 11% of you said true and 89% of you said false. Thank you so much for participating in our polls. Right back to you, Lonnie.
Thank you so much, Tish. So the reason that so many people said it was false is because people no longer come to hospice in their final days. Now, when they have serious illness and they no longer want to have any curative treatments, and their doctor, you know, at least 6 months to live, they will come to us. And the earlier people come to us, the more good we are able to do for them. In fact, for my mom, she did have the 6-month life expectancy diagnosis, but she lived well past that. And it was largely because we signed up for hospice earlier. And that's just what we believe. When we signed up for hospice early, they were able to really give that intentioned love to my mom every single week. And as a result, she just lived longer. So yes, it is definitely false. You would not come to hospice in your final days. You would call us before that, for sure. So when is it time for hospice care? Well, if you can see these signs, if this is happening to somebody you know or your loved one, then please call your primary care doctor and ask if hospice care might be appropriate now. Because if people are going to the emergency room or they're calling their doctor a lot, physically you can start to see that they're going through some changes. They're losing weight. They're falling down a lot more because their balance is off. They decrease in appetite and thirst, like they're not really hungry at all. And they want to sleep a lot, like they don't even want to get out of bed. And when they do, they have a really hard time. You know, they're very weak, and they need a lot of assistance to get out of bed. And also, they start to show different infections within the body and also on the body with regard to skin infections and other breakdowns as well. So you can start to see the changes when it's time for hospice care.
All right, please send us the care button to those of you on Facebook, or raise your hand if you know someone with these symptoms.
Thank you, Tish. So how does hospice care work? Well, first of all, once we get the certification from the primary care physician, we will go to the home and we will provide care at the home by our care team, which you saw on our care wheel was the nurse, the social worker. We have trained volunteers. We also have a spiritual counselor. And we also have a nurse practitioner. So that care is provided at home, wherever the patient calls home. So it could even be in a nursing home or at a residential home as well. And all of the medications associated with the diagnosis that they got into hospice with is included, as well as all of the other equipment that they may need, hospital bed, oxygen, etc. And they can still keep their primary care physician if that's what they would like to do. We never tell them that they have to separate from their primary care physician. We also have our own doctors, such as Dr. Dolan, that will see the patient as well, along with our nurse practitioners.
All right, raise your hand or give me a heart if you know someone that would benefit from this service.
So what happens when you sign up? So once we get the certification from the primary care physician, a nurse comes over to the home. And this is always so important because we want the entire plan to be very, very patient-centered. We want to know what's important to the patient. We want to know what's important to the family. And then we're looking at all of the different, symptoms that the patient is going through, and we create a plan of care. So when we have this care plan, all of the team is following it. So you'll know when your nurse comes, you'll know when your social worker comes, all of these things. And it's just really helpful to the family to know that we got you, we got your back on this. And it really determines how much care a patient needs.
Right, raise your hand or give me a thumbs up if you learned something new. And that is our polling again. It should be up on your screen now. My culture expects me to take care of my family with healthcare needs at home. Strongly agree, neutral, disagree, or strongly disagree. Again, thank you so much for everybody who is joining us both on Zoom and Facebook. Go ahead and put your answers right in there. For those of you watching on Facebook Live, you'll not be able to engage in the polls, but we still want to hear from you. Feel free to put your answers right there in the comment box. Everyone is welcome to the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org. Thank you so much. All right, looks like we have our answers in. I'm going to go ahead and end the poll there and share the results. So 75% of you said they agree, and 25% of you were neutral, that your culture expects you to take care of your family with healthcare needs at home. Again, thank you so much for participating in our polls. Back to you, Lonnie.
Thank you. It makes complete sense to me that the majority of you said that it is actually an expectation in our culture that we need to be taking care of our families. So this is my thought to you, is that if it's your mom, your dad, your uncle, etc., you become such better caregivers if you have the experts come in to help you. Because I hear from so many families that will say, oh, I wish I called the hospice earlier because I could have used the help, but I was ashamed to call them because, my mom said I should be taking care of her. I shouldn't be calling somebody else to come in and help me. But when you want the best care for your loved one, call the best. Call us so we can come and help you, because it isn't shame or against or maybe disappointing to the family that you were not able to provide that level of care because you weren't trained to do it. I remember people would say to me, how do you give a bed bath? I mean, please let us come in and take care of all of those things for you. Now, if at home you're with your loved one and you're with hospice care, and there's some kind of episode at home where your loved one needs a lot more care, they could come to Pohai right here, which is in the center of Hilo. And this is where we provide a much higher level of care and try to manage maybe symptoms that are temporarily out of control at home. So they come here. And what happens is once we stabilize those symptoms, then we send the family or the family member back home. But oftentimes, if the person is already on the natural journey to the end of life, they will often pass here. And believe me, this is the Mauna Lani of hospice. There's a beautiful facility is made with that thought. We really want to royally help and take care of patients that come in here. And so families will come with them and see them. And oftentimes they will pass here. Now, many people will say, well, oh my gosh, I've saw it. It's such a beautiful place. There's no way that we can afford it. And so if you have Medicare, you will be covered on the hospice care side. For room and board, you can pay private pay directly for room and board. Or if somebody has Medicaid, that will cover room and board as well. And that's why I kept bringing that up throughout this presentation, that Medicaid is very important to have because it will supplement many of the things that you do, and it will really help for out-of-pocket expenses.
For those of you who have not seen our Pohai Malama, type yes in the chat if you'd like to see a virtual tour of Pohai Malama to learn more.
So how it's paid for? Hospice care, which is a wonderful benefit. If you have Medicare, hospice at home is covered 100%. Medications, all of the equipment, all covered. And if you also have any of the other insurances, Kaiser, HMSA, United Healthcare, they all provide the same wonderful benefit. So I always tell people, though, if you can get Medicaid, that will always cover your room and board should a loved one have to go into a nursing home, or say they need to come to a place like Pohai Malama for additional services. So again, all of the hospice care at home is 100% covered. No out-of-pocket expense.
Raise your hand and give us some hearts if you love that hospice care at home is 100% paid for by Medicare.
I'm thinking back when my mom was on hospice. That was one of the main reasons that she wanted me to tell the neighbors about hospice, was because she could not believe 100% of everything that she was receiving was already paid for. So anyway, think about that. Know that hospice care is not out of your reach. It's so within your reach to help any of your loved ones. Now, the trained volunteers that we have, they're absolute earth angels. I mean, they go to the homes and sit with the patient, largely to help give time off and rest to the caregiver, which is really, really important. We often call families and offer a trained volunteer to come so that, the caregiver can have a few hours to do whatever they need to do, whether it's, mow the lawn or sleep or go to the bank or whatever it is that they need to do. And oftentimes we will be told, no, I can take care of my husband. I don't need anybody to come over here and do this. Anyway, we will really push the issue. The reason we do is because we know if the caregiver gets rest, they're a better caregiver. they're definitely a better wife for sure, or husband, because they're not so tired. You know, like their perspective changes when they just have a moment or two to breathe, because it's extremely, as you folks know, stressful to be the caregiver.
Can I just get a virtual round of applause for all of our dedicated volunteers at Hawaii Care Choices? Yay.
Yay, love them. All right, and bereavement care. So we offer this to all the families that are with hospice. And also we have a support group, a community support group that meets over Zoom as well. So why this part is really, really important is that let's say that when somebody, let's liken hospice care to that of airline services, let's say. So if we were all going to heaven, then we're all booked on Heaven Airlines. You know, some of us will go at 2 o'clock, some will go at 4, some will go at 8 o'clock at night, but make no mistake, we'll all go. For whatever reason, patients who did not sign up for hospice care, well, whatever the reason is, they didn't know about it, they're afraid, they were reluctant, etc. When they enter the plane, they actually don't go to the coach part of the plane. They go to the baggage compartment below the plane. And the reason they go there is because that is just the toughest, coldest, roughest ride all the way to heaven. And it's not only the loved one, all the family goes with them as well. Now, those who signed up for hospice care, they board the plane and they go directly to the first class cabin. And the reason they go there is because that is where all the comfort is delivered. All of it is there, not only for the patient, but for their family as well. And they get that ride all the way to heaven and back. And once they come back, they have the support of 13 months of bereavement care from hospice that will help them really try to fit their lives back in a new way with the loss of their loved one and try to move on. Now, for those who are coming back, and they're coming back through the baggage compartment, many return in just a million pieces, and it's so very difficult for them to pull their lives back together. So again, I tell you, hospice care not only helps your loved one, but really, really helps the family well beyond the time when the loved one is gone. So think about bereavement care, hospice care as well.
I agree. And send that care button or that thumbs up if you know somebody that could benefit from this program, and give Lonnie a heart if you enjoyed her great story.
Thank you. So here, this is our mission: to improve the lives of those we touch by offering support, guidance, and compassionate care of body, mind, and spirit. And especially during these days, you know, any kind of support that we can get is just very, very blessed. I mean, we just love it, and we're so grateful for it. And again, our service area is from Lapuaihoi to South Point, and then we have wonderful sister hospices on the island as well, located in North Hawaii and also in Kona, and they just do an incredible job.
I agree. Thank you for everyone who is tuning in from all over the island today.
So, Tish, I wanted to take this moment. People have been hearing from me talk about how wonderful palliative and hospice care is. Can we just take a moment and show them a really quick clip of a few people that have actually experienced our services as caregivers?
Absolutely, Lonnie. We're getting that video ready for all of you. Should be right up on your screen now. Please enjoy.
Well, every single person in Kupu Care was like an angel. They were right on. They helped me. And then when it got really bad, and so the doctor finally acquiesced. But the doctors, I think, sorry, take too long to plug people into the home health care they need. He got hospice finally, and he was with them almost 2 weeks, and then he passed away. But I could have used them way before. And people need to be informed, you know, by the doctors about kupu care so they can get them plugged in to the help they need. Otherwise, you know, they're going to be in the situation I was in, which was pretty intense for quite some time. Thank God for kupu care, and all the people in hospice were angels. They were wonderful, beautiful people, beautiful, so supportive.
Well, one of the reasons why we went to kupu care was that my husband had found out that his illness was probably going to be progressive and not curable, so he was a little anxious, and so was I. During that time, you know, after he was diagnosed, his idea was spend as much time with the grandchildren so that they would be able to, I guess, remember. He had spent a lot of time with the community, and, you know, so he wanted to spend more time with family. And I think kupu care allowed him to do that. As far as quality of life goes, I think it was exactly what my husband, Barry, wanted.
Thank you. Thank you so much. Tish, should we continue on now? We're coming to the final end.
Yes, we are coming to the final end. I do see a question in the chat box. I will answer that in a text privately to you, but hold on tight just yet. I just want to thank everybody for attending today's Healthcare Talk Story. Very special mahalo to our special guests, Kerri, Dr. Dolan, and Lonnie, for your valued time and helpful perspectives and so many answered questions today. It was incredible. For those joining in on Zoom, there's going to be a quick 8-question survey that will pop up on your screen now. Please make the best selection and click submit, or please make the best selection to all 8 questions and then click submit below. Mahalo. For those of you joining on Facebook, please send us your thumbs up, hearts, and if you enjoyed this presentation, send a mahalo or thank you to our guests. We love to get your feedback on our presentation today because it will help us, your input will help us allow all of us to just gain a better understanding of how we can best serve our community with presentations like these in the future. If you feel you've benefited from this presentation, please let your friends and family know that we are always here and they're welcome to join us the 10th of every month at 10 o'clock. Just RSVP myself for the Zoom link or tune into Facebook Live the 10th of every month at 10 o'clock. The tongue twister right there. So mahalo again for all of those taking the questions. If you have any last minute questions that you would like to ask also, please go ahead and put that in the chat box now. Lonnie, is there any other last words that you would like to say to our guests?
I'd like to share with everyone that especially now during COVID, a lot of people are very hesitant about leaving their homes. And so this kind of care is provided in the privacy, convenience, and comfort of your own home. So both kupu palliative care as well as hospice care is provided at home. And so if you're concerned, we found that in the last year or so, more people chose to receive their health care our services because we could provide them at home.
I definitely agree. And I will just like to add on top of that, our staff, our nurses, our CNAs that go out there, they also take every precaution there is needed. They have PPE, they're all dressed up, they're masked. So your health and safety is the main priority as well. So if any of you are hesitant during this time of COVID as well to have somebody come into your home, rest assured they definitely take all the precautions to make sure that not only you are safe, but that they are safe as well. I'm going to go ahead and put our main number in the chat box. If anybody has any specific questions or wanting to ask any of our great workers here, they can feel free to call us. That number is in there now, 9691733. I know there was some personal questions that came in the chat, and they will be great to answer them for you. So thank you. All right, let's see. We just got a few people finishing up their questions. Thank you so much again. We are just so thankful that all of you got to join us on this beautiful Tuesday morning. Remember that this presentation was being recorded. So if anybody wants to go ahead and reach out to other family members or friends that you think will benefit from this presentation, we will have this up on our YouTube page or a new YouTube channel tomorrow morning. So thank you so much. With that, I'm going to go ahead and end our polling there. I'd like to say mahalo again for Lonnie and your time, Dr. Dolan and Kerri for their valued expertise and answering all of their questions. And mahalo for everyone joining us. Have a beautiful rest of your day. Aloha.
Aloha, everyone. Thank you. Aloha.